Okay, we continue with estrogen. Now, estrogen antagonist. Okay, before we really start estrogen antagonist, I'd like to focus on one point, that is one of the side effects of estrogen that I forgot to mention in the earlier video is increased risk of blood coagulation. Okay, if you're giving estrogen, then there is an increased risk of formation of thrombus. Okay, how this happens is it decreases by decreased antithrombin 3 and increase factor 2, 7, 9, 10. Okay, this one happens at high dose. High dose. Okay. Okay. I think that was one important point that I missed. That estrogens increase the risk of blood coagulation. Therefore, if anyone is at high risk of blood coagulation, then don't prescribe estrogen or be careful when giving estrogen in those persons. Okay, now we move on to estrogen antagonist. Estrogen antagonist. The estrogen antagonists are okay. There is no such groups among estrogen antagonists. They are just drugs. Okay, direct drugs. The first one is anastrozole. Anastra. Anastrozole. Okay, anastrozole. It is an aromatase inhibitor. It is an aromatase inhibitor. It is an aromatase inhibitor. Okay, let me remind you that what aromatase does. The enzyme aromatase converts androstenedione, that comes from the adrenal cortex, to estrone in the adipose tissue, that is later converted into estradiol. Okay, this is the pathway for formation of estradiol. So it helps in the conversion of androstenedione into estrogen. Okay, so if we inhibit the aromatase enzyme with the help of anastrozole drug, then there is decrease in synthesis of estrogen. Okay, so use of this anastrozole is estrogen dependent postmenopausal breast cancer. If a female has breast cancer and that happens to be hormone positive, that is estrogen receptor positive, then we can use it in breast cancer. Okay, there are other important drugs that are used in breast cancer. We'll discuss them in a while, or maybe in the next video. Okay, the next one is clomiphene citrate. Clomiphene citrate is also known as quote unquote fertility pill. Okay, what it does is it blocks estrogen receptor in the anterior pituitary. Thus, it increases feedback inhibition, decreases feedback inhibition, thus increasing the level of FSH and LH, leading to ovulation. Clomiphene citrate fertility pill, it increases ovulation. Okay, it increases ovulation. That increases the chance of pregnancy. Okay, it uses as a fertility drug mainly if the infertility is due to anovulation. We use clomiphene citrate. Bear in mind that it should not be used for more than 6 cycles because constant stimulation of the ovarian tissue may increase the risk of ovarian cancer. Okay, so let me write. We are in clomiphene citrate. Clomiphene citrate. Okay, clomiphene citrate. Okay, how do you prescribe clomiphene citrate? Is that you start from the second day of menstrual cycle and you give 50 mg once daily. It has long half life. That's why you give it once daily, and you give it for 5 days. Okay. So one use was fertility as a fertility drug, and it is also used in artificial reproductive techniques and gamete intrafallopian transfer, also known as GIFT, GIFT or GIFT. Okay. Okay. Since it is a fertility drug, the major side effect can be multiple birth. Okay, multiple birth, multiple birth. And other side effects are hot flushes. Since it is an estrogen antagonist, it causes hot flushes, nausea, vomiting, and other are hyperstimulation syndrome, ovarian cancer, ovarian cyst. Okay, the last one among the estrogen antagonists are fulvestrant. Okay, fulvestrant. Okay, it is a pure estrogen antagonist. It is used in breast cancer that is not responding to tamoxifen. Okay, these were the three drugs: anastrozole, clomiphene citrate, and fulvestrant. Anastrozole is an aromatase inhibitor. Clomiphene citrate, it is better known as fertility pill, helps in ovulation and it therefore increases the chance of pregnancy. And the last one is fulvestrant, that is a pure estrogen receptor antagonist. Okay, this is all about estrogen antagonist. Next time, I think I'll study selective estrogen receptor modulators, also known as SERMs, SERMs.